Welcome back to the True Sports Physical Therapy Podcast. Today's guest, Dr. Mike Piekarski, the combat athlete performance coach. More importantly, Dr. Kickass on Instagram. Possibly the best handle we've had on the pod. Thanks for joining us, Mike.
Hey, thanks for having me.
Okay, we're going to dig into treating the Jiu Jitsu athlete. Big picture, tell me the unique challenges physical therapists face when treating BJJ athletes.
Yeah, so I think one of the things that's interesting with jiu-jitsu athletes is it's like a growing sport. So if you ask like 10 years ago, like people like, what is that? They're going to think that's karate. In addition to the growth of UFC and MMA, jiu-jitsu is kind of like a thing that someone can do if they don't want to get punched in the face, but they can still get like a confidence that they're learning a martial art that's effective, right? So I would say for me, the biggest thing from when I talk to providers is they don't really understand the demands. And it's something I'm pretty vocal about is the demands of a grappling athlete is significantly different from a field athlete. Now, I do think that if you are a sports physical therapist versus your like generic, ortho PT, you are going to be a little bit better prepared because it's not just about calming pain down. There's more to it. So we can take steps. So number one. Number two, I would say it's probably like runners, but jiu-jitsu athletes are kind of like addicts. Like they're going to go back, they're like, oh, I'm just going to go back. I just, dislocated my shoulder. I'm just going to put my hand in my belt and it'll be fine. It's like, what? And I'll admit, I did some of those stupid things before as a physical therapist. Every time it made it worse. So it's funny when people are going to listen to me as a physical therapist because not only do I understand the sport, but I've done all those dumb things. So I was like, okay, let's stop doing this. That's not a good way to go.
Yeah. Okay. So I mean, you're talking to an audience of sports PTs. So sure. We're good with the field athlete. Every once in a while we get a combat athlete, but you mentioned how the demands are different even compared to the field athlete. Give me some specifics on that.
So if I'm working with a field athlete, for the most part, what are the demands of a field athlete? They have to be able to run, they have to be able to sprint, they have to be able to decelerate, they have to be able to cut. And then you could take a throwing athlete, they got to be able to throw. So in jiu-jitsu, there's things that another thing I would say with jiu-jitsu athletes is the goal of jiu-jitsu isn't necessarily to be a better athlete than your opponent, is you're using the skill to make them a worse athlete. So you're going to see a lot of jiu-jitsu athletes that are terrible athletes. They don't need to be good at running. A lot of them don't do strength and conditioning. Their version of cardiovascular training is just doing the sport. So those are some important things you have to consider. Next is things that would be traditionally what I would say that a lot of PTs run into is let's say they're working with someone who's a back injury. They're we're going to do a lot of core training in neutral. If you ever seen jiu-jitsu, my spine is never in a neutral position. I'm in a twisted, rotated, flex position with load, dynamic load, because somebody's trying to get to my neck or get to my leg or something. So that's not going to exist, right? So it's how do we prepare the spine for the demands of the sport? And again, like I said, neutral spine doesn't exist. Next, we could kind of say for something like hip mobility, I would say you'd kind of maybe look at a dancer per se, where you kind of want abnormal hip mobility that a baseball player has no need for, right? So that's going to be something that's important, but it's not solely flexibility. So again, I could be super bendy, but the problem is I have to be strong in those weird positions because it could be someone where somebody's torquing my arm. Again, we're thinking PT, right? So it's not just do I need sufficient shoulder internal rotation, but someone's literally trying to go to the point where it gets to its breaking point. So I need to be strong in that end range. I need to have strong eccentric control there because again, maybe that's not enough where I can stop or avoid the submission, but maybe that just gives me a little bit buffer to tap so I don't get hurt. Maybe it gives me a buffer so that the tissue in the shoulder is just getting a little bit more resilient because, I would say clinically strength is range of motion specific. So if you're not training your shoulder rotation, you're not training your hip rotation, when you're put in these weird positions, your body is not going to be prepared for it.
Yeah. I think that makes a lot of sense. I mean, I've worked with a number of UFC fighters, not good athletes, dude. It's crazy.
They're not. It was funny. I remember I was in PT school, and at this point, I had a few fights, and I'm thinking I trained with UFC fighters. I had a professional fight at that point. Like, I'm a pretty good athlete, and like we were in like some like, and PT school is not really geared towards athletes, but we had some like advanced strength and conditioning coach where we went into like a weight room, and we did some like athletic tests, like T tests and stuff. And I'm with these my classmates, and I'm like, whatever. And I was like, I'm terrible.
It's really crazy. Do you think it progresses as the years go by? Do we get better field sport athletes, let's say, or explosive athletes in jiu-jitsu world?
Absolutely, right? Because now that there's money, so like, what would you say is the best athlete in the U.S.? Probably like football, just because of money, right? Like, you want to make a lot of money, you go there. Maybe in like other countries, you'll say soccer. But
yeah.
I would say now that like more and more money is going into MMA, it becomes more of a viable sport. So like, I would say if like someone like Francis Ngannou or Cyril Gane, so they're both, Francis Ngannou is from Africa. Cyril Gane, he grew up in France. I would say if both of those fighters were born in the U.S., they would be in the NFL.
Yeah.
And like what's fascinating is you take someone like John Jones, like both his brothers are like NFL players. I think they both have been to the Super Bowl.
One of them was a Raven, for the record.
Oh, there you go.
Yeah.
So what's crazy is like John Jones, who's arguably the best fighter ever, is like the worst athlete in the family. So just for perspective, right?
Yeah.
So
yeah.
I think now that there's going to be more money in the sport, now that there's going to have more athletes getting to it. Now, that's from the UFC and MMA. Now with jiu-jitsu, so this year there was a really big tournament where the winner won $1 million. So now there's like a lot of money. So there's some people. So classically, what happened is jiu-jitsu people would get to a point where they make whatever money they can in grappling, and then they have to switch over to MMA because that's the only way we can make money. But now there's some of these guys that are making, like, again, they made $1 million. Like, there really is no incentive for them to go into MMA because if anything, they'll make less money. So right. Again, now we're getting some people, like there's a I think he's like a 4-time NCAA champion, Jason Nolf. He's a super high level wrestler, one of the best wrestlers in the country. And he's retired from wrestling, is coming over to jiu-jitsu because he can make more money in jiu-jitsu than he could in wrestling. So now we're going to get these super, super high level athletes coming into grappling. And I think that's going to continue to elevate the sport.
Yeah, I love that. Future is bright in the BJJ world.
Sure.
Okay, now you touched on it previously. I want to apply it to the shoulder. You talked about some of the mobility that these guys will have, but also the need for stability or control at end range. Can you just walk me through, specifically as it pertains to the shoulder, how you try to address both of those buckets when treating your patients?
Yeah, I mean, so I guess the trick is, like, was it the Mike Boyle or Greg Cook who was talking like joint by joint stability, mobility? I don't really know if that applies to something like jiu-jitsu because you kind of need both simultaneously. Like, you take the shoulder, right? So the shoulder's the most mobile joint in the body, but it still has to be stable enough from a sports perspective. Because if you can think about jiu-jitsu, it's a reverse kinetic chain collision sport, meaning that I'm doing a lot of closed kinetic chain positions. So I can't just it's not just about making sure I'm strong if someone's torquing my shoulders. I also have to stabilize myself because I'm basing out for balance. I'm basing out to get to different positions. So,
and basing out is putting weight through upper extremities?
Yes.
Okay.
Yeah. Sorry. Yeah. So like basing out, like I'm in a dominant position, somebody's trying to reverse position. So they're trying to go from top to bottom, so if you have to take balance, right? So the classic balance, you can use your ankles. And then if someone does a perturbation, it's a little bit more. Now you use your hips. And then when they both fail, then you have a step response. In jiu-jitsu, it would be a reach response. So the reach is the posting to kind of reestablish your base of support to keep your center mass inside. But again, that could be like a single arm, like someone's explosively trying to push me off and I need to base out with one arm to make sure that I'm stable. So you kind of have to do both. So clinically, obviously I want to restore range of motion, but it's not just range of motion quantity, it's quality, right? So it's someone's torquing my shoulder, it's pain at end range. Well, that's literally what my training partner is trying to do, right? So I got to make sure that I'm resilient at that end range. So restoring restoring range of motion. Then I want to strengthen the complete range of motion. So it's not just in mid-range. I do a lot of isometrics at end range. I do a lot of eccentric training to end range because they're going to be put there. And then we can progress them to closed kinetic chain to make sure that they're stable there as well.
And give me some exercises in all of those positions. What specific exercise do you use in that closed chain position?
So closed kinetic chain, you could do anything like for me, like any type of like a push-up hold. You can do push-ups in general. That's kind of like a base one that I'll do. You could do like a crawling variation, some type of, a lot of times I'll even do like a single arm push-up hold. I might be doing something with my other limb, right? But they're stabilizing that way. That's
how do you, okay, so that makes sense. How are you coaching scapular positioning in those exercises?
I guess it just depends on where they are. If I feel like it's an improper thing, obviously that's the thing is there's that cue like shoulders back, which is not necessarily ideal. It's like more like you want to try to keep the scapula like moving in line with the glenohumeral joint. So it's kind of like you almost want like a sticky scapula versus like a tight scapula. Right? So I guess it would be kind of a little challenging for me to say how I would cue it without having someone in front of me. But again, I would want to make sure that they have good scapular control from that position.
So that makes a lot of sense. A lot of my experience is in baseball. So I think one of the underserved or undertouched positions is scapular protraction. I think as a field, we are obsessed with retraction. So that's kind of the way I'm thinking about it in the closed kinetic chain positioning. Are you preaching, no, you want to spread your shoulder blades, you want to press through the floor, or are you thinking retraction? Is it both? Like, how do you coach that in a crawl lesson?
I mean, I want to make sure. So I'll even do scapular protraction, retraction, kind of like a push-up plus, but I kind of will change it slightly different because from a protraction position. So, and we'll get to this. So for me, when I'm grappling, right, like I need to touch my opponent to initiate. So essentially obviously I'm reaching out, but then I want to add that scapular protraction to give me that little bit of extra, you know what I mean? So I need the protraction to gain control. And then I might add some scapular retraction to kind of essentially connect my upper extremity to my trunk. Make sense?
Yep. Yeah. Okay. So that makes sense. Another thing that I like to do when talking more open chain would be Turkish get-ups. Can you just walk me through like where that shows up in your jiu-jitsu return to sport or rehab?
So Turkish get-ups are, I don't know if they're controversial in the jiu-jitsu world. There's some people that say they're awesome for jiu-jitsu. Some people say they're terrible. I would say that Turkish get-up, so people like it because it emulates sport, meaning that like you take an object, you're going from a supine position, you're transferring to tall kneel to standing and back down, right? And like literally in jiu-jitsu, I have someone who's trying to hold me down and I have to stand up. Then you can argue, then there's people who argue you don't want to be training sport specific in the weight room. You should be training sport specific in the sport, get strong in the weight room. The thing that I think the Turkish get-up does well, right? Because you're always going to be limited with your upper extremity strength, and we can talk about this, but you don't really need to have good overhead strength for jiu-jitsu because it's a position you're not really in, right? So you're always, that's always going to be the limiting factor is how much can the shoulder push overhead? Like my legs might be able to do way more. But one of the things that I like about the Turkish get-up is I have to maintain some level of rigidity as I move. And essentially, if there is like a leak, I'm going to fall or I'm going to not be able to progress. So it kind of teaches like almost like a loaded, like a combination of mobility and stability because I have to move through a series of positions, but I got to maintain that. So for me, clinically, depending on the person, I absolutely use Turkish get-up. Funny enough, when I was in PT school, me and my classmates, we did a presentation and we had to it was like teaching a movement. So we're like, let's do the Turkish get-up. And at first the professor was like, that's not something you're going to do in physical therapy. And we're like,
dude, that pisses me off so much.
Well,
why would they say that?
We were able to do it. And funny enough, as a physical therapist, I did quite a bit. So it's like, I think the problem with PT school in general is like, they're not like, you don't go to PT school to be a sports PT. Their job is to make you a generalist. So it's like, I think to become a good sports PT, you got to do the extra learning, Con Ed, and kind of do it on your own. So for them, they're like, that's not their focus. But I agree, like it's, not ideal. And obviously I disagree with their statement.
And it's frustrating. I feel like I rant about grad school curriculum for most of these pods. Hey guys, excuse this interruption, but I just wanted to give a quick shout out to our new Overhead Athlete course. This course teaches you everything as to how to get your athlete back on the field better, faster, and stronger. It is taught by a former professional baseball player, and we break down specific pathologies, exactly how to treat them, exactly how to load them, and exactly how to get them all the way back. So check out that Overhead Athlete course that we just launched. There is a link down below in the description. Now let's get back to our conversation. So when you were coming out, like with that experience, there was no Dr. Kickass, or if there was, it was you. So where should someone be getting combat sport rehab education outside of Dr. Kickass?
I would say the only clinical rotation which is more combat sport focused is going to be the UFCPI. So the UFCPI, it's associated with the UFC. They have a lot of physical therapists. They take students. So if you're like you want to do clinical rotation and you can get to Vegas, that's probably the only thing that I know about, right? Because it's not like, it's not like other sports where like, football, baseball, like they have staff physical therapists. Like most MMA don't have, there might be like a physical therapist or chiropractor who's associated with the team and they help out, but they're not like built in, right? So I would say the UFC is the only way you can really get that formal education. And then obviously, self-plug anything that I put out for sure.
Yeah. Is there anyone else doing combat sport education like you are?
So there are some people I think that are trying. Trent Nesler, I think he put out a course. I don't know if it's any good, but because he is a lot of courses on ACLs. So I think he's trying to put some. But other than that, I don't know anybody who's putting content out. One of the things that I would say that I do that a lot of other physical therapists don't is one, I'm a Jiu Jitsu black belt. I've been training Jiu Jitsu for almost 20 years. I've been a professional MMA. So I have like the sport background. Obviously I'm a PT. I've been a PT for 10 years. OCS doesn't really matter, but it just means I'm the type of nerd who's going to do all the research. But then that last thing is I've actually done a very, very deep dive in the research of everything that I could find in combat sports. So it's not just clinical experience or, skill experience, but it's like I take that and then I combined it with literally everything I can find online.
And that's why you're on the True Sports Physical Therapy podcast. Because of that. Okay. Tell me, I wanted to dive into shoulders, like I said. Tell me what kind of shoulder injuries BJJ guys are getting.
So the two most common is going to be some type of shoulder instability, whether it's a subluxation or dislocation. That's going to be probably the most traumatic to the glenohumeral joint. And then the next is going to be an AC sprain. So an AC joint sprain where someone lands on top of the shoulder. They're going to be the two most common that I'm going to see. And then that would be, if you want to break it down to macro injuries, and then the micro injury, we can kind of say, shoulder instability could be just the accumulation of trauma where literally someone's wrenching on my arm. So then from the shoulder instability, whether it's from a macro trauma or micro trauma, increases the likelihood of like a labral tear.
Yeah. And what types of repairs are you seeing in the labral pathology in the jiu-jitsu population?
I don't know if this is like US specific, because like I know in other countries they'll do the ladder jet, which I'd never even heard of. I don't know. Someone said that they're doing it in South. I don't know if that's true. But I know it's more common. Like there's a prominent jiu-jitsu athlete who just had it in Brazil. I would just say Bankart's probably going to be like the most common that I see for any type of like labral pathology.
Yeah. Have you seen enough to say one way or another which you'd rather see to getting an athlete back?
I don't know. I don't think I've seen enough to really say one way or the other. It's I don't know if it's like surgery specific or surgeon specific, right? Like I work with some surgeons and like, because it's location based. So what the surgeon does, Like that's what I get access to, right?
Yeah. Yeah. I mean, I'll say anecdotally, I used to see ladder J's for recurring subluxations or dislocations. And those dudes used to like not be able to move their shoulder. I think they've gotten so much better at it. First of all, doing them arthroscopically or minimally open. Second of all, I just think their surgical technique. I went to a shoulder conference in DC a couple of years ago, and they were talking about guys in France, which is where ladder J comes from, like educating the world population. They have gotten so much better, and they are so much more stable. You know, they're blocking that anterior glenohumeral joint with a piece of bone. You're not dislocating. I would imagine. I don't see as many BJJ guys as you do, obviously, but that's a far more stable repair. Do you see a lot of recurring joint instability or dislocations out of a bank cart
after surgery? No, I don't think so. I don't think so. They're pretty good.
Okay. Okay. So what is different about getting those guys back than the baseball population back? What is actually different based upon your interventions, whether you're doing baseball return to sport or you're doing BJJ return to sport?
So I would say the most of the rehab, the acute, subacute phase is going to be pretty much the same, right? Then just the sport specific stuff. If I'm working with the baseball player, I'm doing a great exposure to throwing. We're doing throwing programs, etc. Right? Because that's what they need to be able to do. There's some things that they don't need to, that doesn't need to change. Some things that will be pretty similar. Again, I'm still going to be doing, I'd say for a baseball player, obviously shoulder external rotation is a pretty important thing. So I might be a little bit more aggressive to try to restore that range of motion. Obviously there's a fine line of like the 160 to 180 degree arc. Like how much do I really want to get, or is it good enough? Jiu-Jitsu athletes, they don't necessarily need like 120 degrees of external rotation, but they need to be able to be externally. They need to have, I would say, at least 90 because that's considered normal, and they need to be strong and stable there. I would say from a baseball player, I didn't go too crazy with doing closed kinetic change stuff for baseball players because I don't think it's super relevant. Not that I couldn't. Would be focusing on more like fast, like muscular endurance, fast twitch. Jiu-Jitsu athletes still need fast twitch, but they need a little bit more stability because like you don't need to do things fast. It's more about absorbing energy fast, like somebody's aggressively trying to torque your arm.
Okay, gotcha. I love getting my baseball players closed chain. You're right. They need it open chain. I just worry about how much of entire cuff recruitment can transpire in the open chain, which is why I put them closed chain. Once you restore those, you get them strong at their end ranges. How the hell do you get comfortable with them returning to rolling?
So it's a graded exposure. So it's never, so what's frustrating, and I don't know if this is with other sports too, people like they look at your physician, they listen to the physician over anybody else. And, I've had people who, the surgeon clears people with no return to sport testing. They're like, it's been 8 months, go back. I'm like, are you kidding me? And then I have to be the bad guy and say, hey, this is what I'm going to do. I'm also in this weird situation because, the town that I live in, I'm also one of the head jiu-jitsu coaches. So if the jiu-jitsu athlete sees me, I'll be like, you're not getting on the mat. Because I'm the one teaching class, and I'll be like, you have to go to a class that I'm not teaching, or you know what I mean? It just, because I literally see them, you know what I mean? The advantage in that is also that when it comes to live training, they can be training with me because I'm not going to be hurting. So first thing we do is when I feel like they're ready to get back to modified training, it's a graded exposure. So I can break it up to, first there could be like clinical drilling or technical drilling. So they're just kind of like practicing the moves in a static position, which is not live. Okay. Next, we can get them to what's called flow rolling, meaning there's live training, they're moving around, but there's no focus on winning or losing. So a lot of times jiu-jitsu athletes, the goal is to get the submission. When I get someone in a joint lock or a stranglehold, they can see, they say, hey, don't break my limb. In flow rolling, there's none of that. So there's never that winning component. So you can kind of like go back and forth, but you're moving. It tends to be at a slower speed. The trick with that is you need people, one, you need a training partner who knows how to flow roll, and you yourself need a flow roll. So I've worked with a lot of jiu-jitsu athletes that tell me, like, I can't flow roll. That I'm saying, like, you're not going back because, especially if they're not doing it with me, right? Because there's some people that I'll do like an online return to sport, and I'm giving them guidance on how to do it. So if they can't, then I can't get them back. I go through whatever return to sport test I'm going to do as a phase. Once I clear them, then we can do what's called positional training, meaning that in jiu-jitsu, so there's going to be the takedown phase, then you get to the ground, and then there's going to be what's called passing the guard, meaning you have one person on their back, and then the top person is trying to get by their legs. Because what makes jiu-jitsu different from other martial arts is you can be on your back and still be effective in some level because I can use my legs, right? I can use my legs to reverse the position. I can use my legs to get to a submission, whether it's an arm lock, neck lock, or a leg lock. From there, you pass the guard. Then you can do what's called bad position training, whether you're in like a kind of like a pin, a side control pin or mount, and you're escaping. So generally, I break it into that where we just do the component. So it might be all we're doing is passing guard. So there's not really a lot of submissions. You're just trying to clear, and we can do variations top or bottom. And I kind of broke it down. And when we talk about my some of my courses, I'm going pretty in depth where there's certain positions I avoid based on certain pathology. So we could take shoulders because we're talking shoulders, right? So we know that you're going to get more shoulder injuries if you're doing what's called a low pass, meaning that I'm like really aggressively smashing their leg. So if I'm working with someone and they want to get back to jiu-jitsu and they have a shoulder injury, they might be doing what's called loose passing, meaning that they're staying more upright and they're trying to like dance around their legs versus smashing them down. Right. So that's a way where the arms are in a lot less risk of getting attacked. There is obviously risks of if I essentially I get swept and I'm falling down where I fall improperly, but like, that's less of an issue in most cases. When I say shoulders, I'm talking glenohumeral joint, because if I'm working with someone who is an AC joint sprain or repair, I actually would prefer them doing smash passing. So it kind of depends on what we're doing, right? When you're training jiu-jitsu, you could do what's called training in the gi or no gi. So the gi is like that kimono where it's like this thick uniform that people can grab on. And no gi, it's like training in shorts and a rash guard. So a lot of times for shoulder injuries, I actually would prefer someone to train no gi, because if you look at the statistics, arm locks are going to be much less common in no gi just because it's slippery. It's hard to hold it down. People are just going to opt for other attacks. So this way I can give people not only guidance on like what aspect of training they can do, but what aspects of training they're most in danger of re-injuring themselves.
Okay. I love that. And the reason that's so important goes back to like the first thing you said. We're dealing with addicts. Like we're dealing with people that need to get back on the mat, and you're giving them enough to kind of keep them A, safe, and B, like have that itch scratched. So I think that's awesome. That's super technical to like understand that. So if you're seeing BJJ guys and really get them all the way back from surgery, that is an awesome plug for your treating the jiu-jitsu athlete course. That's stuff that you're just not going to find elsewhere. So thank you for sharing that. Is there any objective measurements that you do before you start mat work?
So we'll stick with the upper extremity. So there's a series of tests. A lot of the orthopedic return to spets for the shoulder happen to be closed kinetic chain, which is great because I think that super applies. Like again, so if you work with a lot of baseball players, you can tell me if you think these all apply, but I might do like a push-up test. Not necessarily a quantity of push-ups. It's more of like, can they do it without pain? There was this test that I found online, which I liked, kind of followed like a similar scoring as like the closed kinetic chain upper extremity stability test, where it's like 15 seconds of push-ups, 45-second rest, you take the average, and then you can compare that number to age range norms, which tends to be like 14 to 20 push-ups. And for me, the score itself is not super relevant. It's like, can they do it without pain? And then I want there somewhere between 14 and 20. You know, obviously, there are going to be a lot of people that just aren't good at push-ups, so the number is going to not be great. But that would be like my like preliminary return to sport. Next, I will use the upper extremity, the closed connect chain upper extremity stability test. I think that test has good validity. Again, it's closed connect chain. It's more of like it's a power endurance because you want to go quick and you have to do it somewhat fast. There's a component of single arm stability, but it's not quite single arm because you're using both. So again, I use that. I think that gives me numbers. So I think under 21, you're at higher risk of injury. So like when I'm returning someone to participation or modified training, I want to make sure that they can do the test, but they might be under 21. Okay. Next, what we're looking for is then as I ramp people up in training, I think over 21, so 22 is good. 25 is a goal. I think 25 is what they found. So that's where I like to get someone. Next, I'll do Y balance upper, just because that's a single arm stability test. Again, so now I can compare sides one versus the other. And again, if they can do that and they're within 90 to 95%, I'm going to be confident that they can do all those things I said, like they can base out, they can support themselves, etc. So those are some tests. In a perfect world, if I can do dynamometer tests, like I'll use the Ting Q, or how do you say it? You know what I'm talking about? Yeah, Ting. Yeah. I mean, I can get that one. I just started playing around with it. I like the use of dynamometers because I can get like real objective numbers. Obviously, the setup's a little bit tricky. But I was thinking about that one article that you shared with was kind of like the position that I would set people up in, where they're in like a supine position, 90 degrees of shoulder abduction, but then they keep them at 0 degrees of rotation, and that allows me to do external or internal. I haven't gotten to use that one yet, just because I was thinking about position, but that is one I'm going to start using. So those are like the orthopedic tests that I use. I've seen some other ones, but those are the ones that I primarily use because I said, one, Jiu Jitsu is a closed connect chain sport. So if they can do that, I'm happy.
Yep. I think that makes a ton of sense. I love what you're saying about using Tyndek. It's a great setup kind of once you get the hang of it. You can also look at internal versus external. They also have a series of norms. You can also do rate of force development. You can also do torque to body weight, like all those things that are like standardized in baseball. I think that's an awesome application to the BJJ guy. By the way, like we treat a ton of lacrosse literature. I mean, BJJ kicks lacrosse literature's ass. Like there's so much more stuff on the combat side than there is in lacrosse. There's just not a lot, but I just steal from baseball. Because a pitcher's arm's got to work way better than a lacrosse's arm, right? The lacrosse player's arm. So, True Sports Physical Therapy is growing like wildfire. We have 14 locations, soon to be more. We are throughout the state of Maryland. We're in Pennsylvania, in Lebanon, in York, Pennsylvania, as well as in Delaware, in Newark and Wilmington, Delaware. Like I said, so many more practices to come, and we always need outstanding sports physical therapists. Our treatment style is unique. We are one-on-one with your athlete for 45 minutes every single session. You do the entire treatment. You do the entire evaluation, and they are in state-of-the-art facilities where you have room to run, throw, and jump, and really get your athlete all the way back to on the field and better and stronger than they were. We also have outstanding salaries, comp structures, bonus abilities, 401ks, as well as a very strong continuing education offering, including in-house continuing education. And we're looking for you. Now is the time, as we are growing like crazy. Just shoot your resume over to Yoni, YONI, at True Sports PT, or shoot us a DM, and we will hit you back. We will get you in for our unique, tried and true interview process and really make a determination that this is the right place for you to grow your career and get your athletes better than ever. We can't wait to hear from you. That's really awesome. Give me some mistakes that you consistently see PTs make when treating the combat athlete.
Okay, so one, neck injury. So you have to think that like a lot of like, I mean, most of the attacks in jiu-jitsu is me like trying to strangle someone. So like there's going to be a lot of neck injuries, right? And it isn't always like a macro trauma. But like jiu-jitsu people are just going to get beat up next because it's like someone's trying to strangle them. Like I could have 10 different people trying to wrench my neck in a session, right? And then you do that for months and years. So obviously that adds up. So there is a cervical strength component. A lot of times I see when people are working with jiu-jitsu people, they're doing, really basic exercises, scapular training, but they're not addressing the neck in any way. Like your neck needs to be strong. And not only is someone attacking, like a lot of times I'm using my head as a post. Like I put my forehead on the ground so I can use my body. So I think that's a big thing. Some of the methods that I'll use for that is I do a lot of isometrics, whether it's self-isometrics. I can teach them how to do my isometrics. We can do slow isometrics. We can do fast isometrics. I tend to do like a ballistic isometric more for like a striking athlete because they have to anticipate like the punch, like someone hits them and they can stiffen. But I still can build that in for a jiu-jitsu athlete. There's a lot of body weight holds. I don't like neck bridging, so you'll see a lot of wrestlers do it. Obviously.
Have you seen Mike Tyson doing that crap, dude? It's bananas.
However, there's an interview where he says that the neck bridge was terrible for his neck, and he has had a cervical spine fusion. So it's one of those things like, it was good and his neck got strong, but it's like when we're selecting exercise, we have to kind of say, what is the risk versus the benefit? And can I get something that has less risk with similar benefit? Absolutely. I'm in a situation where me being a, physical therapist, I'll buy equipment or I understand tools. So like some people, obviously the advantage of the neck bridge is it's like doesn't cost anything, but I don't, you to fact that like a lot of people that are doing that are like wrestlers, but like after the age of like 22, until jiu-jitsu came out, people just stopped wrestling. So I don't know if there's like good longitudinal studies, like what happens to a wrestler's neck when they're like 40 or 50, right? One of the things in jiu-jitsu you're going to see is there's more master athletes because it's a little bit nicer on your body. Like I have a student, 58 years old, and he's still competing. He's actually at his rank, he's a purple belt, which is kind of like a mid-level, but he's a world champion at 58 years old, which is pretty cool. So you're going to see people who it's almost like I would say like a midlife crisis where a lot of people that are middle-aged can still do something and feel good about themselves. But like, it's going to be a little bit harder for those people to maybe be doing like competitive wrestling or like boxing. Right. So anyway, like I said, lack of neck strength is a big one. I kind of touched on this with spine is, people are coming in, you have a back injury. Let's do a lot of core training and neutral. Man, I definitely think that misses the mark. Maybe like some,
what should they be doing?
So I would say in like the acute, subacute phase, if something hurts, like don't do it, right? You know what I mean? So you have to understand their pain triggers, take away the pain trigger. Maybe some of those like core training in neutral is good for up to that subacute phase. But when it comes to return to sport, your spine needs to be able to flex. So like the guard essentially is I'm in a supine position where my knees are to my chest. And I'm trying to keep someone back based on the lumbopelvic rhythm. As someone's coming close to me, my knees are coming to my chest. Some point, there's going to be some amount of spine flexion. And it could be an end range spine flexion. It's going to be loaded too, because I have someone literally driving into me. So I'm trying to push them back. So after we get them obviously out of pain, we have to restore their ability to flex. And they don't necessarily need fantastic spine flexion, but I want them to have some spine flexion as like a buffer, right? Where I don't want that if their spine doesn't flex, then whenever they're in that position, they're already at their end range, which is maybe not ideal. So I want to give them a buffer. So for me, when I'm doing spine stuff is obviously I want to make sure spine moves in every plane of motion, flexion, rotation, etc. So I need to restore that. I'm doing a lot of end range isometrics. I do a lot of like segmentation of trying to get like someone to differentiate moving at different segments. So I could be a little bit more specific on them, like making sure that multifida is firing. I would say if you look at a lot of, I was talking to, I was working at a sports clinic and I was talking with, my boss at the time, and he's like, he didn't really like the way that spine, like he looked at like shoulder research and rehab, and he's like, we got this down for baseball players. We don't really have anything with for the spine. And I think because the spine's, it's maybe not as easy to kind of tune in, but I also think that a lot of times people will skip steps where like, I got to make sure that like, let's say you do some type of like motor control exercise, like TA activation, which I don't really do that. I kind of like take it to a different level, but those might be appropriate in the acute phases. But if we're trying to make the multifidi muscle hypertrophy, we need a sufficient load and volume to make that happen. So whatever you're using in the acute phase, if you're in the return to sport phase, that is no longer creating an adaptation. So I'm doing, we know that the multifidi is, a slow twitch muscle. I'm doing a lot of training to failure because I got to make sure that those muscles have good muscle endurance so that they don't fatigue, because it's going to happen.
Yeah. And you're doing that with GHD. What else?
So I could do that. I like doing, even if I don't have a reverse hyper, I like doing, because you can, like you can grab a box, you can grab a table. So I'll do that. I'll do, instead of just doing like isolated lumbar extension, I'll do like segmental movement. So I'm segmentally flexing and extending from that position. I could do the same thing where we take a cat-cow. We can do cat-cow with like, essentially they're like self-imposing an isometric tension. I might do a cat-cow from like a hip hinge position. And then I can even have them like hold a weight. So essentially what they're doing is they're in like it's like a somewhat weighted position. I kind of go back and forth with the Jefferson curl because I do think that it can be beneficial. I think a lot of people jump to it too soon and they don't have the spine that's ready for it. So there's a lot of things I'll do before I would consider like a Jefferson curl.
But you would think that provided that they're there, that it's a worthwhile exercise to load multifidi to get segmental flexion extension to force them to control. So that's awesome that it's there. What about rotation? And what about other planes of motion? We've only really talked about
so sagittal. I would say that, obviously the spine needs to be able to rotate and side bend. So for me, like I'll do, so I use a lot of functional range systems. So I'll use a lot of spine cars to kind of restore those other planes of motion. I don't really think you need a ton for like the lumbar spine. I don't think you need a ton of lumbar rotation. Maybe for the thoracic spine you do, especially for like a striking athlete, they need a ton of thoracic rotation. And I need to do same thing where it has to be slow, fast, probably similar to a pitcher, right? Because you need to rotate like that. I tend to do more thoracic rotation if I'm dealing with like a rib injury, which is another thing I think people don't do well. I don't know if it's PTs or just the medical field. It's just like you strain your rib, just rest. But it's like, I feel like that, if you can rehab any musculoskeletal injury, why would you not rehab the rib, which is a musculoskeletal issue? You know what I mean?
Yep. I had a UFC player with SC issues, dude. Not easy, but you got to deal with it. I think you're totally right. He went to a doctor and it was like, just rest. No. That's not going to get you back necessarily on the mat as quickly as you'd like. So, okay, let's trace back to scapular mechanics and kind of what opened your eyes with the correlation between scapular dyskinesis commensurate with the level of jiu-jitsu training. Tell me about what you thought about that and why you think it is.
We talked, there was an article that you'd mentioned and I took a read. I don't think it's as much of an issue as it would be for a overhead athlete, even though that article said there was more. That being said, how much is the scapular kinesis the cause and how much of it is the symptom, right? So in that one specific article, it looked at scapular dyskinesia in jiu-jitsu athletes, but it was the non-dominant arm. If I'm reaching, I'm primarily reaching with my dominant arm. So like if I'm with a striking athlete, the striking athlete might be leading with their non-dominant arm. So I stand orthodox left hand forward. In grappling, most people are standing right hand forward. So if it was more of a postural overuse, I would have expected to be much more the dominant. So the fact that it's in a non-dominant and the fact that in the article they found that anyone with scapular dyskinesia, had I think it was 67 to 100% chance of having a shoulder injury. So I would almost argue that I think that the shoulder injury causes this kinesia. So then it's like, well, I'm just going to, I still have to address the glenohumeral injury. And then the supplement is addressing the, scapulothoracic, which I probably would be doing anyway, because again, it's a closed kinetic sport. I need to make sure they're stable. Right. So I like I said, I think it's more of a, you hurt your shoulder and now you have some problems with the scapula. Because like I mentioned, like you don't need good overhead motion in jiu-jitsu. I think there's very few positions, like you could probably have about 140 degrees of flexion and you could do everything. So right now, the best jiu-jitsu guy in the world right now is Gordon Ryan. He's very publicly gone on interviews saying like his shoulder range of motion is trash. Like he can't raise his arm overhead. And he's the best and it's not even close. Right. I would say from a sport specific position, the only time you really need good shoulder flexion is if, let's say, you're shooting for takedowns. So it's more of a wrestling thing. So I'm grabbing somebody's leg and they would do what's called a sprawl. So they're dropping their hips. So I'm in this overhead position while they're hanging out. That's pretty much all I can think of. Other than that, you have 140 degrees of shoulder flexion, you're going to be good enough. Like I don't really raise my arm overhead that much.
And how about internal rotation? I guess that shows up in arm bars, right?
Kimura. So you can break arm locks. Yeah, so you can break arm locks into like a linear elbow lock, and then there's a rotational shoulder lock. So a Kimura is going to be a forced internal rotation, and Americana is going to be a forced external rotation. Then there's going to be some other positions where they're not directly a submission, but it happens if I get what's called an underhook. So let's say I'm trying to grab somebody's shoulder, I get like what's called an underhook. So what someone's going to do to counter to make sure that I don't have as much control is they're going to get an overhook, which is essentially going to force me into external rotation. So it's like an indirect force external rotation. But those are like sport specific, whether it's a position or a joint lock. I have to prepare my athlete for it.
Yeah. Okay. Yeah. I mean, that makes a lot of sense. Any special or specific equipment if I'm going to rehab jiu-jitsu athletes at the highest level that I need to put in my facility?
Trying to think. I mean, there's things that I'll do just, from a neck training perspective. Two products that.
Are you an iron neck guy?
I am, but I also like the next level. So I think the next level is better for neck rehab. Have you ever seen it? So essentially it's like this platform, you lay on it and then you can rotate it. I think the iron neck is better from like the advanced strength and conditioning phase. And I know that they market it for rehab. I don't think the iron neck is great for rehab. Just because it's harder than people realize. Like I worked with a ranked UFC fighter. And thankfully I was not working with him when this happened, but he strained his neck with an iron neck. It was too much. And he's like, and it's like you watch this guy and he's a tank. I do think it's great though. I do think it's good. I think the iron neck allows you to train. One, it allows you to increase the load a little bit more in a safe position. I think it allows you to train cervical rotation better than a lot of other things. So that's kind of like the tier from rehab. I do next level strength conditioning. I would progress you to the iron neck. Another tool I like for the spine is something called the back sink. So I'd like doing a lot of segmental work, and essentially it's like this thing, and you can kind of try to make isolated spine movements. Like maybe you're doing like a glute bridge, and then you're kind of coming down one segment at a time. And I like the back sink because it gives you an auditory or a visual cue of like when you're doing it versus if you're just like clunking, right? And the reason why I do a lot of spine segmentation is if you look at the lumbar spine, the most common segments that are going to be herniated are going to be L4, L5, L5S1 because they move the most. So if I can get those segments above or below moving better, it deloads. And, anecdotally, if we look at like a lumbar fusion, someone gets a fusion, a few years down the line, they need another segment fuse, same sort of thing. That's why I want to make sure that I can get other things moving so they're not just kind of consistently overloading that one segment. So those are like equipment that I would use. Obviously, squat rack, weights, kettlebell. I have never gotten to work with a reverse hyper. I've just kind of like jury rigged stuff. Like, I find, like I said, I'll use like a table, like a high-low table, massage table, a box that works. I do kind of wish I had access to one. There's this interesting piece of equipment that I have not worked with, but it looks pretty cool because you can train. That's called like the Freak Athlete, where it's like you can do like a Nordic curl on it. It's like this. It's almost like think like a bench press that you lay on with these different things where you can so there's a way you can do like a seated knee extension. You can do like Nordic curls. It does it like you can arrange it in a way that you could do like a reverse hyper motion. So I like the idea. I've never gotten to try it out, but it looks pretty cool.
Yeah. Yeah. Interesting. How much is a back sink?
I don't know.
Okay. Well, they should be sponsoring this pod if they're that good.
I think when it comes to tools, I don't like going too much into pricing because it's like, obviously sometimes someone's going to look at it and say, I don't want that. But if like you're dealing with a lot of jiu-jitsu athletes with spine injuries, which they do, I think it's beneficial for sure. Okay.
Yeah. That makes a lot of sense. Okay. Let's wrap up with giving me your pitch for treating the jiu-jitsu athlete, which is your continuing ed course. Why should people take this course? How do we take it? And tell me what you love about it and what's coming next.
So the treating jiu-jitsu athlete, I honestly, like I said, I think it's essentially a unique continuing course for the jiu-jitsu athlete. I don't think there's anything out there that, if there is anything else out there, it definitely does not go into the depth that I do. It's 10 hours. I got it approved for Con Ed. And I think about 44 states for PTs. It's sponsored through the BOC for ATs. So need Con Ed credit. There you go. And like I said, I think the jiu-jitsu athlete, the demands are different than a field athlete. So you as a sports PT, obviously you have there's so much more research out there when working with baseball players, football players, etc. There's not as much for the jiu-jitsu athlete. So I compiled everything that I did. I used my clinical experience and my understanding of jiu-jitsu. So I kind of break it down where initially the course kind of, if let's say for you don't really know much about jiu-jitsu, kind of breaks it down like, this is what these positions are. This is what you can expect. Yeah. Then what I look at is I kind of explain so you kind of know, because not everybody's a UFC fighter. Like you're going to have a 35-year-old, weekend warrior where, he has a job, but, he does jiu-jitsu and he competes. Honestly, they're my most common client because the athlete, the jiu-jitsu athlete doesn't have money or health insurance. So they don't really come because they don't want to pay. Right. But like the person with a job, they'll come because they have health insurance or they have money. They understand the importance. Right. So then we kind of go into looking at the different injury trends. So you can kind of know like, how are people getting hurt? Where are they getting hurt? What are some of the risk factors? What are some of the unique jiu-jitsu injuries that you're not going to see in baseball? And then I kind of I break down like what is the rehab from an acute phase, subacute phase. Now we transition into that return to sport. I do touch on return to sport. A lot of the tests that we mentioned from upper extremity, I look at some of the lower extremity. And then what we do is then I kind of look at from a performance standpoint, like how do we optimize the athlete? Because a lot of jiu-jitsu athletes, it's not just about getting them back from injuries. How do we work on performance? And then in the last part of the course, I touch on concussions just because there's a lot, people don't realize that you're going to get a concussed in a grappling sport, not as much as a striking sport, but it's going to happen. But, most athletes, because it's, they're not associated with high school, so they don't have an athletic trainer who's doing any type of screening. They get a concussion and they're right back in. So it's really important for that PT to kind of have the awareness of what's going to happen and, kind of like how you get someone back after a concussion.
That's awesome. That sounds so well-rounded. How do I sign up for it?
I can send you a link. It's
okay, but how does the audience sign up for it, Mike?
Hopefully on this podcast, you can add a link, but the best way to find out about it would be, on my Instagram, my bio, I have a link to the course.
Okay. And your Instagram, as mentioned, is Dr. Kickass. So you'll find them.
_Kickass. Yeah, and I'm working on a second course currently, which is going to be Jiu Jitsu Rehab Mastery. So now what I'm doing is I'm going like position, like body part by body part. So I go spine injuries that happen in Jiu Jitsu, how I specifically rehab. So it's kind of like taking what we talked about into much more detail. I look into the research on things like motor control exercise. Do spines adapt, or specifically discs? That's a big thing. Talking about like flexion. Why is it important? I look at like arm injuries, whether it's like a UCL, because the arm bar is going to primarily damage the UCL. But, like we talked about, a jiu-jitsu athlete can be a little bit different than a baseball player. Obviously, a UCL tear for a baseball player is going to be much more of a problem, but it's still a problem for a jiu-jitsu athlete. And then, I go from shoulder injuries, I go into hip, ankle, knee injuries. Some of those return to sport concepts I talk about, like what's a risky position if you're a jiu-jitsu athlete who just had a MCL tear? What would I say avoid, right? And then I go in much more detail on objective return to sport of you just had an ACL surgery. When can you get back to drilling? When can you get back to flow rolling, right? Because, for something like ACL that we know the return to sport, the full return to sport is 9 months after clearing testing. But when can they be doing something, right?
Yep. That is awesome and sounds unbelievably comprehensive. I got to take it because my buddies are on me to pick up BJJ, and I'm terrified I'm going to get hurt. So I definitely got to take that. Mike, you've been a pleasure, dude. Thank you so much for being here. As we stated, follow Mike, Dr. Kickass, on Instagram. Obviously, a world of knowledge. Thanks for sharing it here, Mike. Appreciate you and appreciate everyone who listened. Bye-bye. It's the True Sports Physical Therapy Podcast. Tune in. You might just learn something. Catch all of the full episodes on all streaming platforms. And as always, the link is in the bio.